Good morning, everyone. If it's your first time joining us here at the college for a webinar, welcome. And if you've spent some time with us before, welcome back. We are excited to bring you an informative and engaging webinar today. And first, I'm going to get started by asking my colleagues to introduce themselves. We're going to give you a brief overview of the agenda for the webinar, and then we're going to dive right in.
Good morning, everyone. Thank you for taking the time to join us today. My name is Abby Kalanandan, and I'm the coordinator for quality assurance and assessments here at the college. And I'll be speaking a little bit about the educational and training requirement in order for a midwife to prescribe and administer opioids on their own authority in public hospitals. Yeah, thank you for being here today.
And I'm Victoria Marshall. I'm the Communications and Stakeholder Relations Officer here at the college. And I'm going to help facilitate the question and answer period at the end of the webinar. And I'll just note now that the question and answer box is open throughout the whole webinar. So please feel free to pop your questions in as they come to you, and we'll answer all of them at the end. Thanks.
I'm Megan McCarroll. I'm the Director of Professional Practice and Policy. I'm going to give you an overview today of the new regulation. I'm going to answer some previously submitted questions as I go through the regulation updates. Then we're going to have an opportunity to complete the Safe Prescribing and Administration of Controlled Drugs and Substances course together today, followed by a Q&A. We're going to try and keep the material really tight into 1 hour and then have the Q&A session either right at the end of that hour or a little bit beyond the hour. We very much hope that you can spend the entire time with us, but if you do need to leave, we completely understand. All right, so as you are all aware, we have a new regulation under the Midwifery Act. This is the Designated Drugs and Substances Regulation 188/24. And this means that it's the 188th regulation passed in 2024. The new regulation adds additional drugs and substances to the list that midwives may prescribe and/or administer on their own authority. Access to these new drugs and substances will reduce the need for midwifery clients to seek care outside of midwifery for treatment that is within the midwifery scope of practice, and this is going to improve the quality and timeliness of care for clients. The College of Midwives worked with the Ministry of Health over the past few years to find the right path forward for Ontarians. We are happy to see this expansion to the list of drugs and substances that midwives can prescribe and administer on their own authority. These changes will provide improved access to treatments within the midwifery scope of practice. While we are pleased with this expansion to the list, the college recognizes that specified lists of drugs and substances are at risk of becoming outdated as new drugs and substances become available and practice standards change. We will continue to work with the ministry to find a sustainable solution for clients to continue to receive optimal care from midwives. So without further ado, what is new? You are going to notice that this regulation looks very different from the previous regulation. Something is going to immediately jump out at you. There are some categories in this regulation. You're going to see categories of drugs and substances listed in the new reg, and we're going to start at this point. There are two categories that I'm going to bring your attention to, and these are the category hormonal contraceptives and the category vitamins, minerals, and fluid replacements. I might stumble over that a couple of times. Forgive me, I'm a human being. So let's get started with vitamins, minerals, and fluid replacements. This is a category in the regulation where you won't see a list of specified defined medications. This means that midwives can now prescribe and administer a variety of vitamins, minerals, and fluid replacements. For example, intravenous iron sucrose. The other category, hormonal contraceptives, encapsulates a wide variety of contraceptives. Hormonal contraceptives include oral contraceptives such as the combination and progestin-only pills, the patch, the contraceptive ring, and hormone-releasing IUD. Now, in the previously submitted question, some of you have already asked us about the medication device Nexplanon. This injectable long-acting contraceptive is also included in this list for midwives to prescribe. However, midwives will still require a delegation from a physician or a nurse practitioner in order to actually insert the device, because midwives do not currently have the controlled act of performing a procedure under the dermis for this purpose. So it's an important note. Also of note, the copper IUD, which does not release any medication, is actually classified as a device, not as a drug. And so it doesn't appear on this list of drugs, but prescribing and inserting this method of birth control continues to be within the scope of midwives. That has not changed. What else is new? Though the previous regulation had a few vaccines listed, the new regulation contains a greatly expanded list of vaccines that midwives may now administer, both for adults and for infants. You can take a look at the list on your own time because it's quite long when you check out the new regulation. It's important to note that not all vaccines actually require a prescription. At this time, Tdap, influenza, and COVID-19 vaccines are available to midwives through the publicly funded vaccine program, so they don't require a prescription. Some folks have asked for some clarification on infant vaccines, which may only be administered for babies 8 weeks and older. I know that that's a bit of a hot topic because of that 8-week versus 6-week scope of care, confusion. So I'm just going to break that one down for you today, and feel free to reach out after the webinar if it's still a point of confusion. So while the controlled act of communicating a diagnosis of a disease or a disorder is limited up to 6 weeks of age or 6 weeks postpartum for midwives, midwifery care may extend beyond this point. It is within the midwifery scope to administer 8-week vaccines, to insert an IUD at 8 weeks, or provide a prescription at 8 weeks, as long as there is no communication of a diagnosis of a disease or disorder at that time. So I'm actually going to draw back a little bit, and I'm going to reference the Controlled Act specifically now. So the Controlled Act actually states that communicating a diagnosis is identifying as the cause of a woman's or newborn symptoms, a disease or disorder that may be identified from the results of a laboratory or other test or investigation that a member is authorized to order or perform on a woman or newborn during normal pregnancy, labor, and delivery, and for up to 6 weeks postpartum. For more guidance on this, you can actually check out our scope of practice guiding document. Using the definitions that I just described, the midwifery scope of practice involves providing care to individuals during normal pregnancy, labor, spontaneous vaginal birth, and for up to 8 weeks postpartum for both clients and newborns. Any person who falls outside of this time frame is not considered within the scope of practice, so midwives cannot provide care to them on their own authority. This means that midwives are not permitted to provide midwifery care to anyone who is not pregnant or postpartum, or who are not in labor or spontaneous vaginal birth. Midwives also cannot provide midwifery care to babies over 8 weeks of age, with a disclaimer, unless you work in a model where you have expanded midwifery care, expanded scope. There are obviously gray areas, but broadly, midwifery care ends at 8 weeks of age or 8 weeks postpartum. The reason why the college defines that time frame as such is it can take approximately 8 weeks for the body to return to a pre-pregnant state, as you all know, and that ends the postpartum period. There are also midwives, as I said, who are working in expanded midwifery care models, so I don't want anybody to clutch their pearls and be stressed out by that. There are some midwives who are providing midwifery care outside of that time frame, but for the purpose of the definition of scope, the time frame is care up to 8 weeks, communicating a diagnosis up to 6 weeks. All right, so we're going to move on. Another really exciting change in this regulation is the inclusion of opioid analgesics. So this is another exciting development, which we're seeing in the new reg, and it's an expanded list of these analgesics, which midwives may prescribe and administer in the hospital setting. I'm going to repeat that now. These medications may only be prescribed and administered for intrapartum pain relief in a hospital setting. There will be no access to such medications outside of the hospital. The new regulation permits midwives to prescribe and administer in hospital settings only for controlled substances. These include fentanyl citrate, meperidine, morphine sulfate, and nalbuphine. This means that midwives will no longer have to obtain a physician's order to administer these drugs for intrapartum pain management. Midwives must complete specified education and training before prescribing and administering opioids on their own authority. We're going to be completing the required course during this webinar today, but it is in your best interest to take a look at the regulation and understand exactly what specified education and training would apply for you. So let's talk about oxytocics and prostaglandins. These are included in 2 sections of the regulation, so you're going to find them in 2 different spots. Under Schedule 1 of the regulation, which are drugs that may be prescribed, which in this case are for the purposes of preventing and treating postpartum hemorrhage, inducing or augmenting labor, cervical ripening, and for the management of spontaneous early pregnancy loss or retained placental tissue. Medications under the Schedule 1 heading include dinoprostone, ergonavine, misoprostol, and mifegamizole, the combination drug mifegamizole. Under Schedule 3, which are substances that may be administered by injection, you're going to find oxytocin, ergonavine, carbetocin, and our old favorite, carboprost. So I'm going to talk about two different medications while I have everybody here together. The first one is misoprostol. So there's some changes to misoprostol. In the previous regulation, misoprostol was restricted for the treatment of postpartum hemorrhage only, but this restriction is no longer in place, and midwives can now use misoprostol for other uses within the midwifery scope of practice, including inductions of labor with PROM or for the treatment of early pregnancy loss. We did have a question come through earlier about cervical ripening timing and whether a midwife may use misoprostol for cervical ripening for the purpose of an IUD insertion. It's a great question. The regulation does not restrict midwives from administering misoprostol for that purpose, but as with all medications, there must be a clinical indication for the use, and midwives must possess the knowledge, skills, and judgment to provide any therapy while meeting the standards of professional practice. The second medication I want to chat about is mifegamizole, the combination misoprostol mifepristone. So the new regulation permits midwives to prescribe misoprostol mifegamizole, for the management of early pregnancy loss. Midwives may continue to use this medication on the order of a physician or a nurse practitioner for the termination of pregnancy. All right, moving right along to antimicrobials. Many new antimicrobial medications have been added to the regulation. These include antibacterials such as antibiotics, antifungal medications, and antivirals, and they're found under the related categories. In the updated regulation, it is now possible for midwives to prescribe and administer medications for treating several sexually transmitted and bloodborne infections. These medications have been added to permit midwives to treat many conditions that fall under the midwifery scope of practice. Oral antibiotics medications can also now be prescribed by midwives for the treatment of a variety of infections, including some UTIs, some STBBIs, and these are listed under Schedule 1. Injectable antibacterial medications are also included in the new regulation, and you're going to find a list of these under Schedule 3. The college continues to work with the Ministry of Health to align updates to the Lab Specimens Collection and Licensing Centers Act with the expanded list of medications. So we're trying to align that Act's changes and updates with our new regulation. So stay tuned for information about that. The public consultation is still open at this time for submissions regarding the changes to the Lab Specimens Collections and Licensing Centers Act. So if you haven't provided your insight, I strongly encourage you to do so. Moving along, we have the hemostatic tranexamic acid added to the new regulation as well. You're going to find that medication under Schedule 3 for administration by injection. Now, this is pretty exciting as well. Another piece that you're going to see that is new is administering a medication on the order of a nurse practitioner. So since the new regulation continues to specify lists of drugs and substances, midwifery clients may need to access necessary medications that are not on this list from time to time. And we all know that. In the past, midwives could access these medications only on the order of a physician. But now midwives can receive these orders from a nurse practitioner as well as from a physician. Midwives can now engage in work alongside both groups of allied healthcare professionals to continue to expand access to healthcare for midwifery clients in Ontario. Another thing I'd like to chat with you all about today is additional emergency drugs. The new regulation includes the drugs and substances that are used to provide routine midwifery care, as well as drugs and substances that midwives use to manage emergencies in the home, hospital, and birth center settings. But midwives can also use additional emergency drugs that are not listed in this regulation by way of the exception granted in the Regulated Health Professionals Act. The RHPA grants an exception to the prohibition on performing any controlled act, including the controlled acts of prescribing a drug or administering a substance by injection or inhalation, to any person in the course of providing first aid or temporary assistance in an emergency. This means that in emergencies where the midwife is the most appropriate person with the required knowledge, skills, and judgment to provide temporary assistance, the midwife can access any drug necessary. The college provides a lot more information specific to this exception. Please take a look at our website and check out the scope of practice document section 2.2.2, which is exceptions to the controlled acts under the RHPA for more information on this subject. All right, so now the fun part, using the expanded list. Midwives have been using many of these drugs on the order of a physician for years. With the new regulation, midwives will be able to prescribe and administer all items on the expanded list on their own authority, as long as they have the knowledge, skills, and judgment to do so safely and effectively. Everybody here knows that midwives must meet all standards of practice and must be competent in all areas of their practice, including prescribing and administering drugs and substances. Now, one question that we have received at the college following the release of the new designated drugs and substances regulation is, how do I know that I'm competent to provide these new drugs? And this is a really great question because it's a testament to the humility and value of safe and ethical care embraced by midwives. We all want to do a really good job and only offer treatments that are in the best interest of our clients, and that's amazing. It speaks to the level of professionalism which midwives hold themselves to. But the answer to this question is complex. We learn in many different ways, through formal education pathways like the MEP, through professional development like the UBC continuing professional development courses, and through mentorship like learning how to become a surgical first assist at cesarean section. Some of these pathways grant you a degree, a certificate of completion, or a set program of achievements which help you gauge your competence in acquiring new skills or building on skills you already have. Utilizing the medications on this list may require specific education pathways in order to meet the registrar's policy, such as the Controlled Drugs and Substances course, which we're going to be completing together today. But others are extensions of skills you already have. And still others may require ongoing clinical learning in order for you to be ready to safely prescribe and or administer medications from this list. There are many resources that you can consult in order to use these medications safely and competently, including, as I mentioned before, clinical courses, mentorship, and personal study. Ultimately, for each of these medications and substances, midwives must have sufficient knowledge, skill, and judgment to use them safely and effectively. Midwives are expected to seek out the resources, courses, and training that they need to be competent at prescribing or administering any drugs or substances. The college's role is to set the standard of professional practice for midwives, which are available for midwives and members of the public for review on our website. By setting these minimum standards, the college regulates midwifery in the public interest and takes a risk-based approach to ensuring midwives practice in a safe and ethical way. So I'm just going to talk a little bit about some of the questions that we received in advance of our webinar today. And other than the ones that I peppered into the earlier part of the presentation, we were actually able to categorize most of the questions into three main areas. So I'm going to address each of these here. So first off, a lot of people wanted to know about additional funding for education and training in order to safely offer medications. And the college does not, unfortunately, provide funding for ongoing professional development or professional learning. But related to this, some midwives were wondering if there would be an expansion to funding to support midwives who provide additional services, medications, treatments for their clients. This newly expanded drugs and substances list was created in consultation with midwives and with the Association of Ontario Midwives, with the best interest of clients and their newborns as our focus. We understand that midwives will have questions regarding funding for the new services for things like vaccine storage, and these questions can be directed to the Association of Ontario Midwives. Another question theme that kind of came out of our previously submitted questions was integrating new practices into hospital settings. So this is typically the responsibility of representatives of lead midwives. If there's no lead midwife at your hospital, the college can provide you with some assistance in notifying your hospital about expansions to the new regulation. But ultimately, this is going to require some engagement on the part of all midwives to notify either the chief of medicine, the chief of OB, or have opportunistic conversations with your nursing and physician colleagues about the changes to the regulation and what that's going to mean for the provision of midwifery care. Just for an FYI, the college also informed the College of Physicians and Surgeons, the College of Pharmacists, and the College of Nurses about the changes to the new regulation. And the college has asked these colleges to share the information with their registrants. So there should be a healthy amount of information sharing going back and forth between the other colleges and their registrants. So hopefully when you broach the subject or when you raise it with hospital leadership or anybody else who you're working with, fingers crossed, they've already heard all about it and there's going to be no barriers. So the last theme that came out was regarding educational resources and training. As the profession evolves, protocols and procedures are going to change. We know this. And we know that it's up to midwives to ensure that the knowledge, skills, and judgment that you all carry are up to date. The college does not specify routes of professional learning when it comes to ongoing professional development. Midwives can seek out trainings from educational institutions like UBC, from the Society of Obstetricians and Gynecologists of Canada, and from the Association of Ontario Midwives, who have a tremendous amount of resources and clinical guidance, which is accessible to all AOM members. These are just some examples of self-directed study that midwives can engage in to enhance their knowledge, skills, and judgment. The college does supply one training course, however, related to the expansion to analgesic medications, which are listed in the new regulation. And for this, I'm going to hand the mic over to my wonderful colleague, Abby, for the next part of our presentation. But first, I just want to let everybody remind everybody that we're going to be doing our live Q&A following the course. Take it away, Abby.
Thanks, Megan. Can we move to the next slide? Thank you. So as mentioned by my colleague, the new regulation does permit midwives to prescribe and administer in hospital settings only the 4 controlled substances listed in the new regulation. This means that midwives will no longer have to obtain a physician's order to administer these drugs for interpartum pain management. In order to prescribe and administer opioids on your own authority, midwives must complete formal education and training as outlined in the policy on controlled drugs and substances education and training. So this means that if you have completed the UBC course or graduated from a Canadian midwifery education program during the specified year indicated in the policy, you have already satisfied the requirement to prescribe and administer the 4 controlled substances in hospitals. And if you'd like to view our policy, you can find that in our website under the specific section that says designated drugs and substances regulation. However, if you do not satisfy this requirement, you may complete the course developed by the college. Since we'll be taking this free course together today, watching the entire course will satisfy the requirements set out in the regulation. If you have already watched the course, feel free to get a cup of coffee or a snack and come back in 30 minutes for the live Q&A session. Please note, a midwife who previously administered opioids on the order of a physician is able to continue working in this manner without any additional training. However, if one midwife has not completed the specified training to be able to administer on their own authority, they are not able to carry out an order from another midwife to administer a controlled substance. Please note, this e-learning module does not provide any clinical training. This module will help you understand the legislative and regulatory frameworks to independently prescribe and administer controlled drugs and substances in Ontario. It'll help you be familiar and comply with the standards set out in the Professional Standards for Midwives, the Prescribing and Administering Standard, and the Record Keeping Standard. And it'll also help you increase awareness of the opioid crisis in Canada and understand the role midwives play in mitigating opioid-related harms. So completion of this online module will satisfy the requirements set out in Section 1, Subsection 3B, and Subsection 42B of the Designated Drugs and Substances Regulation for Ontario Midwives. So without further ado, we will now be playing the e-learning module, and then after the e-learning module has been completed, we'll come back for the live Q&A session. Welcome to the e-learning module on the safe prescribing and administration of controlled drugs and substances for Ontario midwives. Before we begin, let's go over what this module will cover and how it is structured.
This is a self-paced video. You can proceed through the content at your own pace, ensuring you have time to absorb and reflect on the information provided. Please click the pause button at any time if you need time to reflect on the material or take notes. The module is split into concise sections. Each section addresses key areas of legislation, standards, and professional responsibilities. Please note there are no quizzes or assessments in this course. This module is designed for informational purposes only, aiming to inform and update you on critical legislative changes and best practices. The designated drugs regulation has been expanded to improve client care through more direct access to necessary drugs and substances. In 2024, a new designated drugs and substances regulation came into effect, setting out a list of drugs midwives can prescribe and substances that midwives can administer by injection or inhalation on a midwife's own authority within the scope of midwifery practice. The new regulation adds additional drugs and substances to the list that midwives may prescribe and/or administer on their own authority. Access to these new drugs and substances will reduce the need for midwifery clients to seek care outside midwifery for treatment that is within the midwifery scope of practice, improving the quality and timeliness of care for clients. The changes to the list include hormonal contraceptives, expanded analgesia, additional antibiotics, updates to the vaccines that a midwife can administer to include many routine vaccines clients receive during pregnancy, and other additions to align with current best practices. On entry to the profession, midwives must possess the necessary knowledge, skills, and judgment to safely prescribe drugs and administer substances within the midwifery scope of practice. Midwives must maintain or acquire the necessary competencies throughout their careers to safely prescribe and administer new drugs and substances, especially as medication treatments change. This module does not provide clinical training and only discusses the requirements that must be met to prescribe and administer controlled drugs and substances listed on this slide. For general information about the other drugs and substances, please visit our website at www.cmo.on.ca and access the new regulation. Completion of this online module satisfies the requirements set out in sections 1, subsection 3b, and section 4, subsection 2b of the Designated Drugs and Substances Regulation, Ontario midwives to prescribe and administer in public hospitals on their own authority the following controlled drugs and substances listed on the slide. This module will help you, number 1, understand the legislative and regulatory framework to independently prescribe and administer controlled drugs and substances in Ontario. Number 2, be familiar and comply with the standards set out in the College of Midwives of Ontario Professional Standards for Midwives, the Prescribing and Administering Standard, and the Record-Keeping Standard with a focus on prescribing and administering controlled drugs and substances. Number 3, increase awareness of the opioid crisis in Canada and understand the role midwives play in mitigating opioid-related harms. Section 1, Legislation and Regulation Overview. This section provides an overview of the legislative and regulatory framework concerning the use of controlled drugs and substances within the midwifery scope of practice. It references the Controlled Drugs and Substances Act, the Regulated Health Professions Act, the Midwifery Act, and the Designated Drugs and Substances Regulation. Section 1.1, Controlled Drugs and Substances Act. The Controlled Drugs and Substances Act, known as CDSA, is the federal law that regulates the possession, production, distribution, and sale of drugs and other substances that are considered to be controlled or illegal. A controlled substance is any type of drug that the federal government has categorized as having a higher than average potential for abuse or addiction. Such drugs are divided into categories based on their potential for abuse or addiction. Controlled substances range from illegal street drugs to prescription medications. The primary goal of the CDSA is to protect public health and safety by controlling access to drugs and substances that can pose a serious risk of harm to public health or safety. The CDSA permits registered midwives to prescribe and administer controlled drugs and substances if specified under the laws of the province in which they are registered and entitled to practice. The practice of healthcare, including the regulation of healthcare professionals, falls under provincial jurisdiction in Canada. Midwives in Ontario must adhere to the provincial regulations and professional standards related to the prescription and administration of medications, including controlled drugs and substances. Section 1.2, the Regulated Health Professions Act and the Midwifery Act. The Regulated Health Professions Act, also known as the RHPA, is the umbrella legislation that governs 30 health professions in Ontario, including physicians, nurses, and midwives. This provincial law limits the performance of 14 controlled acts, which are the procedures, tests, and treatments considered to pose a risk of harm when performed by someone who is not qualified to perform them. Because there's a risk of harm in performing controlled acts, they can only be performed by the regulated health professionals who are authorized to do so by their profession-specific acts, for example, the Midwifery Act. In addition, some controlled acts may be performed by individuals by way of exemption, detailed in either the RHPA or in the Controlled Acts regulation made under the RHPA. As set out in the Midwifery Act, midwives are authorized to perform 11 controlled acts. All of the controlled acts authorized to midwives are authorized only partially, which means midwives do not have the authority to perform any of the controlled acts in their entirety without limitation. Midwives are authorized to perform the controlled acts of prescribing drugs and administering substances by injection or inhalation. However, these controlled acts are limited as midwives are only authorized to prescribe or administer the drugs and substances specified in the designated drugs and substances regulation. Midwives may not perform the controlled acts of dispensing, selling, or compounding a drug unless these controlled acts are delegated to them by a health professional who has the authority to do so. Please consider the following definitions of key terms that are used in the legislation and regulation. Delegation. Delegation means a process where a regulated health professional, the delegator, who is authorized to perform a controlled act, as defined under the Regulated Health Professions Act, designates that authority to someone else, the delegatee, who is not authorized to perform that controlled act. When an act is delegated, both the delegator and the delegatee are accountable. Delegation is carried out by either a direct order or a medical directive. Prescribing a medication includes giving written instructions for dispensing a medication by a pharmacist and self-administration of the medication by a client. As well, the act of prescribing can include prescribing for the purpose of administering a medication. Drugs that may be prescribed by a midwife fall under Schedule 1 and Schedule 4 of the regulation. In addition, midwives may prescribe any drug that may lawfully be purchased or acquired without a prescription, as set out in Section 6 of the regulation. Administering. Administering medication is giving a medication through the correct route to a client. Midwives can administer any medication that they are authorized to prescribe. The regulation specifies which drugs can be administered by inhalation and which drugs can be administered by injection, as these procedures are controlled acts authorized to midwives. Drugs that may be administered by inhalation by a midwife fall under Schedule 2 of the regulation. Drugs that may be administered by injection by a midwife fall under Schedule 3 and Schedule 4 of the regulation. Administration of medication by means other than injection or inhalation, such as oral or topical, is not considered a controlled act and may be performed by midwives. Administration of medication for vagina or rectum is authorized to midwives pursuant to paragraphs 7 and 8 of Section 4 of the Midwifery Act. In addition, midwives may administer any substance that may lawfully be purchased or acquired without a prescription, as set out in Section 6 of the regulation. Ordering. Ordering a medication is the way that midwives prescribe a medication to be administered by a nurse in the hospital. This can be a verbal or written order, or may be part of a set of medications that midwives order based on hospital protocols. In addition, midwives can receive orders from physicians or nurse practitioners to administer medications by inhalation or injection that are not included in the regulation as set out in Section 5, subsection 2 of the regulation and 4.1, subsection 2 of the Midwifery Act. In addition, midwives may order any drug or substance that may lawfully be purchased or acquired without a prescription, as set out in Section 6 of the regulation. Using. Using a medication means administration of a medication by any means other than inhalation or injection. This includes oral, vaginal, topical, or rectal routes of administration. Midwives can administer any medication that they are authorized to prescribe. In addition, midwives can receive orders from physicians and nurse practitioners to use medications that are not included in the regulation, as set out in Section 5, subsection 1 of the regulation. Dispensing. Dispensing is a transaction that occurs after receiving a prescription and providing that medication pursuant to a prescription, and involves record-keeping obligations on the part of the dispenser and a resulting label on the drug with identification markings. Dispensing also means giving one or more doses to a client to take at a later time, but it does not include the distribution of drug samples. Dispensing a medication is a controlled act that is not authorized to midwives. Midwives must receive a delegation to dispense a medication. Section 1.3, the Designated Drugs and Substances Regulation. The Designated Drugs and Substances Regulation under the Midwifery Act is the provincial regulation that sets the limits and conditions for midwives to prescribe and administer specific drugs and substances. In 2024, a new Designated Drugs and Substances Regulation came into force, which expanded the list of drugs and substances a midwife may prescribe or administer while practicing the profession. Ontario midwives can now prescribe and administer on their own authority and only in public hospitals the controlled drugs and substances set out in Schedule 4 of the regulation, as long as the midwife complies with the requirements set out in Sections 1, subsection 3A or B, and Section 4, subsection 2A or B of the Designated Drugs and Substances Regulation. Section 1.3.1. Sections 1, subsection 3A and B, and Section 4, subsection 2A and B of the Designated Drugs and Substances Regulation. Section 1, subsection 3A and B of the regulation describes the requirements that must be met before prescribing for the purpose of administering the controlled drugs set out in Schedule 4. Section 4, subsection 2A and B of the regulation describes the requirements that must be met before administering by injection the controlled substances set out in Schedule 4. The controlled drugs and substances listed in Schedule 4 of the regulation are fentanyl citrate, meperidine, morphine sulfate, and nalbuphine. The requirements that must be met before prescribing or administering these controlled drugs and substances are as follows. The midwife must first have either A, satisfy the registrar or the registration committee that the midwife has sufficient knowledge, skill, and judgment based on the midwife's formal education and training to safely and competently prescribe drugs and administer by injection substances set out in Schedule 4. Or B, successfully completed a course approved by the Council on Prescribing Drugs and Administering by Injection substances set out in Schedule 4. By completing this course, you will be satisfying the requirements set out in Sections 1, subsection 3B, and Section 4, subsection 2B of the regulation. Section 1.4, links. For more information on the legislative and regulatory frameworks referenced in this section of this online module, please visit the following resources. The links to all resources are available on our website. Section 2, Standards of Practice. This section focuses on the standards of practice relevant to the safe prescribing and administration of controlled drugs and substances. The standards provide the minimum expectations that must be met by midwives. It is expected that all midwives review these standards in their entirety to understand their relevance to prescribing and administering drugs and substances, including controlled drugs and substances designated in the regulation. To guide this review, this section will highlight specific examples of standards and demonstrate how they may be applied within the context of prescribing and administering controlled drugs and substances. However, these examples serve merely as a starting point. It is expected that midwives will refer to the professional standards for midwives and the complete set of additional standards available on the college website for a comprehensive understanding. Section 2.1, Professional Standards for Midwives. The professional standards describes the minimum requirements regarding one's practice and conduct and helps midwives achieve the best outcomes for their clients and the public. 5 mandatory principles form the professional standards. These principles include professional knowledge and practice, person-centered care, leadership and collaboration, integrity, and commitment to self-regulation. Midwives must be able to demonstrate at all times that they work in accordance with the principles and standards set out in the professional standards, which includes with prescribing and administering the controlled drugs and substances listed on this slide. To help understand how the standard applies to the prescribing and administering of the 4 controlled drugs and substances, the following examples are provided. These are intended to be illustrative and are not comprehensive statements. To demonstrate professional knowledge and practice, midwives must possess the knowledge, skills, and judgment for safe prescribing and administering controlled drugs and substances. Working within the Midwifery Act and the Designated Drugs and Substance Regulation, this includes competency in administering drugs like fentanyl citrate and morphine sulfate, utilizing evidence-based resources for treatment decisions, and committing to continuous learning and self-assessment to improve prescribing and administering practices. To demonstrate person-centered care, midwives must recognize clients as primary decision makers and ensure informed choice in all aspects of care, including when prescribing and administering controlled drugs and substances. This can involve providing detailed information about benefits, risks, and alternatives, ensuring opioid analgesics for labor pain management are administered only with informed and voluntary consent, and respecting clients' rights to accept or refuse treatment. For more detailed information on the professional standards for midwives, please refer to the full document on the college's website. Section 2.2, Record-Keeping Standard for Midwives. The record-keeping standard for midwives outlines the requirements for documentation and record management. It details standards for creating, managing, and retaining records, ensuring they are accurate, legible, and accessible. This includes documenting client identifiers, client encounters, communications, and treatments. It also outlines requirements for the access, management, retention, and disposal of records in compliance with legal standard. To help understand how the standard applies to prescribing and administering the 4 controlled drugs and substances, the following examples are provided. These are intended to be illustrative and are not comprehensive statements. A midwife is responsible for documenting all care they provide to a client, including, but not limited to, recording detailed notes on every aspect of the client's visit, including health status, discussions, assessments, treatments provided, and the rationale behind each decision. Documenting the client's response to treatments and any updates to their care management plans, ensuring all informed choice discussions, including risks, benefits, alternatives, and the client's consent or refusal are thoroughly noted. Keeping accurate records of communications with other healthcare providers and family members. For more detailed information on the record-keeping standard, please refer to the full document on the college's website. Section 2.3, Prescribing and Administering Standard. The Prescribing and Administering Standard outlines the college's expectations regarding the prescribing and administration of drugs and substances, including controlled drugs and substances. The standard focuses on safety, record keeping, legal prescription requirements, consultation and care coordination, storage, and handling. Help understand how the standard applies to prescribing and administering the 4 controlled drugs and substances. The following examples are provided. These are intended to be illustrative and are not comprehensive statements. Midwives must conduct and document medical history, Obtain a comprehensive understanding of the client's current medications. Document all prescriptions and verbal orders. Provide and document follow-up care. And manage and report medication errors as per guidelines. Midwives are not permitted to delegate the controlled act of prescribing. For more detailed information on the prescribing and administering standard, please refer to the full document on the college's website. Section 3, Opioid Crisis in Canada. This section acknowledges the opioid crisis in Canada and describes the roles that the midwife and the college play in mitigating opioid-related risks of harm. Additional resources, further education are also provided at the end of the module. Section 3.1, Opioid-related deaths and harms in Canada. Opioid-related deaths and other harms continue to be a significant public health issue in Canada. The ongoing crisis is characterized by a surge in opioid-related overdoses and deaths, which is driven by a contaminated illegal drug supply, prescription opioids, an increase in substance use disorder incidence, and opioid tolerance and dependence. According to the Public Health Agency of Canada, the majority of the apparent opioid toxicity deaths have occurred in Ontario, British Columbia, and Alberta. The majority of the deaths involved the use of fentanyl and non-pharmaceutical opioids. A similar trend is seen for accidental opioid-related poisoning hospitalizations, where the majority have occurred in Ontario, British Columbia, and Alberta. Efforts to address the opioid crisis in Ontario require a multifaceted approach and collaboration between healthcare providers, including midwives, public health agencies, and the community. Section 3.2, the role of midwives and the college to mitigate opioid-related harms. In the new designated drugs and substances regulation, the college and the ministry agreed to limit the act of prescribing opioids for the sole purpose of administering. Additionally, the administration of opioids by injection are limited to the hospital setting to minimize risks associated with opioid misuse and abuse. This means that opioids are administered by midwives only for acute pain management in labor and does not include prescribing opioids for client self-administration at a later date or outside the hospital environment. Midwives play an important role in ensuring the safe prescribing and administration of opioids. The federal and provincial legislation and regulations and several standards of practice, including those referenced in this course, provide the necessary framework to support safe opioid prescribing and administration. Midwives are responsible for being familiar with and complying with all applicable laws and standards. The responsibilities include, but are not limited to, only performing controlled acts that they are competent to perform within the midwifery scope of practice, demonstrating professional knowledge and practice, collaborating with other health professionals, being accountable for one's decisions and actions, providing person-centered care, and maintaining accurate records. Midwives must also be aware of and follow hospital policies and procedures and community standards when prescribing and administering opioid analgesics. Section 3.3, useful links and resources. For more information, please visit the provided links to resources on the opioid crisis, the college's standards of practice, and the Association of Ontario Midwives website, which provide comprehensive resources, including clinical practice guidelines and a pharmacology app. Links to all resources are available at www.cmo.on.ca. Section 4, Completion. Section 4.1, Closing Remarks. As we conclude this module, remember that as a regulated health professional, your responsibility goes beyond merely understanding and complying with the legislative and regulatory framework. Midwives must be committed to an ongoing process of learning, self-assessment, evaluation, and identifying ways to best meet client needs. Midwives must also work in accordance with hospital policies and procedures and community standards. All midwives practicing in Ontario must also utilize their knowledge, skills, and judgment relevant to prescribing and administering drugs and substances. Legislation and standards can never foresee or address every issue or ethical dilemma that may arise throughout your professional career. Your decisions and actions must be justifiable. (4.2) Declaration of Completion. Congratulations! You have completed this e-learning module on the safe prescribing and administration of controlled drugs and substances. Registrants are required to declare in the college's registrant portal during the 2024 registration renewal period that they understand and are in compliance with the requirements that must be met in order to prescribe and administer the controlled drugs and substances set out in Schedule 4 of the Designated Drugs and Substances Regulation, made under the Midwifery Act. Links to all resources are available at www.cmo.on.ca.